Welcome to Birchwood Animal Hospital. Your pet has been booked for a dental procedure, and we would like to take a few minutes to help you understand the procedure a little better and show you what we do to make sure your pet is comfortable and safe. Let's start with the night before. Please do not feed your pet anything after about 8 p.m., but you can leave water out overnight. Just pick it up in the morning when you get up. And no breakfast, please. But if your pet needs to take medication that morning with a very small amount of food, that's okay. Unless you have been instructed otherwise, please be at the hospital between 7 and 8:30 a.m. At that time, a receptionist or nurse will go through the planned procedure and the estimate with you and answer any questions you might have. As soon as your pet is admitted, a trained nurse will take vital signs and, if required by the doctor or requested by you, draw blood for a pre-anesthetic safety check. Any concerns are immediately brought to the doctor's attention. Then your pet will be given a gentle sedative that will ensure they are relaxed and free of anxiety while they are with us. This sedative also includes a highly effective and very safe pain reliever. When it is time for the procedure, an intravenous catheter will be placed. This permits instant access to a vein for any needed injections, and it allows us to administer fluids that support blood pressure and improve safety. Then your pet will be given an injection that gently and quickly anesthetizes them. As soon as their jaw muscles are relaxed, a tube is placed in the windpipe that allows direct and accurate administration of oxygen mixed with anesthetic gas. We use the very safest gas, exactly like what you would have if you needed a general anesthetic. All this time and all through the procedure, a trained nurse will monitor anesthetic levels, heart rate, breathing, blood pressure, blood oxygen levels, and temperature. Safety is our #1 priority. And now the dental procedure. The first step is to perform a thorough visual examination of the mouth. We can see so much more when your pet is asleep. Then special instruments are used to assess the health of the gums. Gum disease is the most common serious dental health problem. In addition, in many cases, digital X-rays will be taken of suspicious areas. The tooth really is like an iceberg, and so much of what is important happens below the surface. The doctor then assesses all this information and makes a decision about oral surgery, including possibly extractions of teeth that cannot be saved. If this has not been discussed with you in advance, the doctor will call you to explain your options. Meanwhile, the nurse, who is trained much like a dental hygienist, will perform a careful and thorough cleaning. The little pockets under the gums are also cleaned, which is a critical step. The teeth are then polished, not to make them look shiny white, but to make the surface smooth so that it attracts less plaque. Then finally, a fluoride treatment is administered to strengthen the teeth. If extractions are needed, your pet will receive a freezing just like you would, which will help ensure comfort after he wakes up. Special self-dissolving sutures are used to close any extraction sites. Everything is given one last careful check, and then it's time to wake up. The cleaning portion generally runs from 30 to 45 minutes. But if there are complicated extractions, the whole procedure can take 2 hours or more. During the recovery period, your pet is still closely monitored and kept warm and comfortable. Additional pain medications can be given as needed, and any pet that seems worried or disoriented on waking up is given extra attention and reassurance. You can expect a phone call around this time to let you know everything has gone well and to set up a pickup time. When you pick up your pet, you will be met by the nurse who will go over the home care instructions and answer any questions you might have. At this time, she will also discuss prevention strategies, such as special dental diets and treats, as well as how to brush the teeth. Having healthy, clean teeth is not about having a nice smile. It's about having a healthy pet.